It was more for lifestyle than money, but it turned out to be way more successful than I thought.
So yeah, it's interesting. Going to these small towns is oftentimes like a deterrent for a lot of people, but it's also can be a blue ocean. So like, what was it? What was that like? Was there a lot of other dentists, or I mean, did you guys have like wide open
So
fields?
so kind of both, which is so it's there's actually I think 5 or 6 dentists in my town that I work in. A few of them were a little bit older. The town itself is 5,000 people, which is pretty small. We probably pull from a pool about 30,000 in terms of it's pretty geographically wide. There's no
Okay.
specialist. My closest specialist is about 45 minutes away. And the
Oh,
ones I use are about an hour to an hour 15 away because I use a few that I really have really good relationship that do really good work. So I knew that I wanted to do more specialty work. I was doing sedation in the wisdom teeth, but once I got here, I started taking implant training, started placing implants, got a cone beam. I was doing some endo, not all of it, but they were doing a lot more specialty work than had been done within the practice. And I knew that there was that need, within town. So it was Blue Ocean's a good way of putting it. And
yeah, it sounds
yeah,
like it.
and I didn't know. Again, it was more for lifestyle than money. It was you don't need to a lot. I mean, we're living here in this rural area, but it turned out to be way more successful than
Yeah.
than I thought. And I actually wrote an article in Dental Economics probably a year or two ago about rural dentistry, and it's just a fabulous way to practice, especially if you like doing a lot of different procedures. You can't rely on endodontists next door. They're an hour away, and everybody up here is extremely booked. And Vermont has a huge shortage of dentists within the state, and so the demand was huge. And so it
Wow.
worked out to be it was fortuitous. It worked out to be a great situation.